Hi guys, welcome back. Real quick today, this is episode 2 of this advanced series on full arch FP1. So today we are going to focus on how to optimize your appointments, and on your first appointment you must gather all the important information to communicate with your patient and also with your lab. So you'll start with face photographs, and then you'll follow up with intraoral photographs, and of course the 12 o'clock photo that is very important for your digital smile design. Also, I always try to capture a short phonetic video of the patient where I try to capture a full genuine smile, because most of the times you can't capture it with your photos. And then, of course, some additional photos according to your case. So after that, you'll do the clinical examination. Of course, this is a somewhat simple step, but I just want to give a shout out to Make Me Clear, which is a fantastic software to present and plan your cases. And after that, you'll do the scan or impression. And this step you can, 90% of the cases, do it on your first appointment. Of course, if it's a somewhat more complex case, you may want to do another scan or impression, maybe with the trying in mouth, so that you can later on merge that information with the information on your CBCT to properly plan your surgery and your case. Now, many colleagues think that to be digital, they have to have this intraoral scanner, but actually literature says that both bench scanners and intraoral scanners provide surgical guides with the same precision. So it's not an excuse not to do guided surgery or to do digital planning just because you don't have intraoral scanners, okay? And after that, of course, you need your periapical radiographs and bite wings, even if you do the panoramic x-rays for every new patient, because you can't plan properly your restorative cases with just a panoramic. And for your surgeries, you must do a CBCT. As I said before, you can do it on your first appointment if it's a somewhat simple case, but if it's a more complex case, you need to do it on your second appointment already with the trying in mouth, for instance, to plan, let's say, crown lengthening or maybe bone regeneration. And this is very important because we all had these cases where on the panoramic it seemed like the patient had sufficient bone to do our implants, and then you are presented with this kind of mandibles, for instance, and you have to explain mid-surgery to the patient why they need bone regeneration and the costs that comes with it, okay? So after all of this information, you need to send it to your lab with properly mounted models. This is a very important step, not only for full arch cases, but also for aesthetic cases. And of course, in the back office, after your first appointment, you may want to do some basic DSD to help guide your lab during the wax-up, or maybe you can go one step further and do the full DSD design to show your patient your final result. So that's it for today. I hope you enjoy it, and stick around.